Accutane helps your skin renew itself more quickly. What is Accutane? Accutane is a form of vitamin A. It reduces the amount of oil released by oily glands in your skin and helps your skin renew itself more quickly. Accutane is used to treat severe nodular acne. It is usually given after other acne medications or antibiotics have been tried without successful treatment of symptoms. Accutane may also be used for other purposes. What is the most important information you should know about Accutane? Accutane can cause severe life-threatening birth defects if the mother takes medication during pregnancy. Even one dose of Accutane can cause major birth defects of the baby's ears, eyes, face, skull, heart, and brain. Never use Accutane if you're pregnant. Women of childbearing potential must agree in writing to use 2 specific forms of birth control and have regular pregnancy tests before, during, and after taking Accutane. Unless you have had a total hysterectomy or have been in menopause for at least a year, you are considered to be of childbearing potential. Accutane is available only under a special program called iPledge. You must be registered in the program and sign agreements to use birth control and undergo pregnancy testing as required by the program. Read all program brochures and agreements carefully. It's dangerous to try and purchase Accutane on the internet or from vendors outside of the U.S. The sale and distribution of Accutane outside of the iPledge program violates the regulations of the U.S. Food and Drug Administration for the safe use of this medication. What should you discuss with your healthcare provider before taking Accutane? Ask your doctor or call the drug maker if you have any questions about the program or the written requirements. It's dangerous to try and purchase Accutane on the internet or from vendors outside of the U.S. Don't use this medication if you're allergic to Accutane or to parabens, or if you're pregnant or may become pregnant. Before taking Accutane, tell your doctor if you're allergic to any foods or drugs, or if you have a personal or family history or depression or mental illness, heart disease, high cholesterol or triglycerides, osteoporosis or other bone disorders, diabetes, asthma, and eating disorders such as anorexia, or liver disease. If you have any of these conditions, you may need a dose adjustment or special test to safely take Accutane. Accutane can cause severe life-threatening birth defects if the mother takes the medication during pregnancy. For women, unless you have had your uterus and ovaries removed or have had total menopause for at least 12 months in a row, you're considered to be of childbearing potential. Even women who have had their tubes tied are required to use birth control while taking Accutane. You must have a negative pregnancy test 30 days before you start taking Accutane. A pregnancy test is also required before each prescription is refilled, right after you take your last dose of Accutane and 30 days again later. All pregnancy testing is required by the iPledge program. You must agree in writing to use 2 specific forms of birth control beginning 30 days before you start taking Accutane and ending 30 days after you stop taking it. Both a primary and a secondary form of birth control must be used together. Primary forms of birth control include tubal ligation, your tubes tied, vasectomy of the male sexual partner, an IUD, estrogen-containing birth control pills, and hormonal birth control patches, implants, injections, or vaginal ring. Secondary forms of birth control include a male latex condom plus spermicide foam or gel, a diaphragm plus spermicidal foam or gel, a cervical clamp plus spermicidal foam or gel, a vaginal sponge containing spermicide. Do not take St. John's wort, which is a herbal supplement, if you're using any type of hormonal birth control, including pills, patches, implants, injections, or a vaginal ring. Breakthrough bleeding may occur. Stop using Accutane and call your doctor at once if you have unprotected sex, if you quit using birth control, and if your period is late or you think you might be pregnant. It's not known whether Accutane passes into breast milk. Do not take Accutane without first talking to your doctor if you're breastfeeding a baby.